Good Friday afternoon, and welcome to another Coping with COVID information and updates to help us through this pandemic called COVID-19. I'm Tre Tailor, and today we have my very first guest. We had some technical difficulties that day, and actually, you were the motivation for me even starting Coping with COVID, Tasha. We talked about this off air, but Tasha and I attend Brooklyn Baptist Church together, and during that first service, Pastor had you on to kind of tell everyone about the pandemic. And I thought to myself, she has such great information. And I thought first, I said, well, I'm going to bring Tasha on. But then it was so much more to share. So Coping with COVID was born. So thank you. So Tasha, I know on your page, because you are with the medical practice, is that the name of your
medical place?
The medical place practice on Sunset in West Columbia.
That's right.
And you've been posting some great information on your page. Tell us about some of the things that you've been posting. I saw today the hand washing.
Right. And so, I've just been trying to, as I've talked to patients, and my patients are my inspiration, believe it or not, in my office. And as they think about questions that they want to ask me about what's going on with COVID-19, that's what makes me think about, well, if this person has a question about it, there could be a lot more people that have the same question. And so when I start to see themes of questions being asked, I said, I'll just pop on real quick and let me just share some information. And it's unscripted. It's just things that I have learned from all that, because we get inundated with a lot of emails from the American Academy of Physicians and the CDC every day. So we're getting updated information all the time. So I just want to share what I've been learning as we are learning about this COVID-19.
Yeah.
So that's where those videos start to pop up.
Well, one of the videos that you did do was about wearing a mask. And I particularly wanted to do it because it's been, about a week now since the CDC recommended that everyone wear a mask. But one, I don't see everybody wearing a mask. And two, I see people wearing masks and I wonder, like, for instance, I see people wearing masks in their car. So I thought, do I need to be wearing my mask in my car? So I wanted to bring you on to talk about mask wearing 101, how to wear it, when to wear it, how to clean it, and why it's important. So first, tell us when we should be wearing our mask. And I have my mask, and I have a cloth mask. And that's okay.
Now, what material is the mask made of? Do you know?
This is denim. I have 3 masks. One is denim, and all of them are about the same kind of material. My nephew in LA made these.
Okay. The CDC has been recommending a little bit more towards the cotton. And I think the reason why is because of the washability of it.
Gotcha.
But denim should be okay too, because they were saying even if we use the cotton ones, they want us to have multiple layers. So they don't want the cotton to be thin.
Right.
So I'm thinking denim is okay. And they also wanted to make sure that the shape and the structure of the mask does not change. Okay. So sometimes with certain materials, I think after usabilities and washing, it may change the shape. So that's just their recommendation, that you make sure that you have something that is durable. So like I said, so denim should be okay.
Very durable.
Washable.
Right. And it's got a couple of layers. Yeah, he's got it double layered. Mm-hmm. Does this look like a good shape? Because it goes on pretty well.
It does go on. And so that's, what we want to talk about is, of course, and that's a stylish little mask there you have. So I have not branched out yet to the stylish ones. People have been saying they wanted to donate some to me, and I said, "Oh my! I feel like a movie star if I get one of the special ones, because I still have to wear. I've still got the."
Now, is that an N95? Is that because...
No, it's just a regular surgical mask.
Okay, surgical mask.
This is just a regular surgical mask. I think multiple sites may have them. Not sure if you can find them in the stores. I think they're slowly getting back in stock. And I think just because people have laid off of buying so much, because everybody's making their own. So I think now you're actually going to be able to find some if you need them. But this one is not necessarily, like you said, we could just have some covers that we can make for some.
Well, that's interesting you say that, because my nephew is also making mask covers. He's making covers for people who have either the N95 or the surgical mask. If you want to spruce it up a little bit,
Right. Exactly. Maybe I'll get one that, monogram say B on the side.
Right. You should. You should get some that are monogram for all of your employees. Chris Levy Johnson has those at Levy's funeral home.
Yeah.
He does. He's got the
Yeah.
black mask and they have leaves on the side.
I don't want the black one.
Yeah. Well, I get a blue one. I don't know.
Oh goodness.
Yeah.
But yeah,
Okay.
so
So,
this is so start with clean hands
okay.
because
Oh, yeah.
that's valley important. If you have it in your car, like sometimes you may have to run out. You might not remember to wash your hands, but you have it in the car when you have to run into the store. That would be perfect. But ideally, to start with clean hands, of course.
Okay. So
And
wash your
then you
hands and then.
actually, yeah, then put on the mask. And you want to actually start with the loops around your ears first.
Okay.
Is the key is to put, so you're trying to keep as less contact on the
Oh,
inside
see. Yeah. That
because
makes
this is the clean part. And also for those who get the surgical mask, and if you have multiple colors, usually the color is on the outside. So like mine says, I don't know if you can see, but the white is on the
the
inside
white
and
is
then
on
the
the
blue.
inside.
So the color is on the outside. Okay. So
Okay.
that's
Okay.
key. So if you do that, and then you put over your, then what you do is you actually pitch down for those who have, I don't
Mm-hmm.
know if you can hear me. Can y'all still hear me with the mask
Yeah.
on?
Yeah.
Okay.
Yeah. We can.
Okay. Then you pinch down your nose. Then you pull down for those who have the surgical. Then you pull down around your chin.
Mm-hmm. Because you
So
want it to
because you
cover
want
your.
the cover,
Yeah.
right?
Right.
Because you want that seal around the area here, around your nose, around your mouth, here to kind of protect yourself from getting exposed to the virus. That really is the key.
Okay.
And so any material that you have, you got to be able to have that nice seal and be able to breathe. So it has to be breathable.
That would help.
It helps.
Can you breathe?
But can
Yes.
you breathe comfortably? Like, can you walk in the store and can you walk around with this? You may have it on for an hour. It just depends on what your activities are. So you actually going to have to be able to, comfortably be able to breathe.
Yeah.
And then you just do the opposite. You use the air. Try to use the ear wings to, take it off. It's
Gotcha.
ideal because the important thing is you want to try to keep the inside clean.
Okay. Gail Smith asks, is eye protection needed also?
No, it's not. Not if you're not going to be exposed to somebody that that has it. That we have to wear all those shields when we're in the acute care setting, the urgent care ERs and hospitals because respiratory droplets are everywhere in that setting. With coughing and sneezing, it's not just going to cough and sneeze. Unfortunately, this direction is everywhere. So when you see all the nurses and everybody that's working in the ER with the shield, that's why
Okay.
because of how respiratory droplets kind of spread.
Well, I remember you told me early on because I asked that question when we did our first interview, and you said, there were no mucous membranes in your eyes, and that's why you don't need to cover your eyes. Is that correct?
Yeah. Yeah. Well, no, I mean, but the eyes are a source of entry into the
Really?
body. So,
Okay.
yeah. So, I mean, you can enter it that way, but it goes, it's respiratory. So it's droplets that way.
Gotcha.
But like I said, you just can't protect when somebody sneezes and they're not covering, or if you're thinking about somebody in the ER and they're intubating them and mucus, saliva, and everything is flying everywhere. You got to be able to protect your whole face. But
Right.
when you're going out to the grocery store and just doing your basic living, you shouldn't need an eye cover.
Okay. Thank you, Gail. So no eye
Yeah, thank
protection
you.
is needed. All right. So you told us how to put it on. Put it on
Right.
by the ear piece.
Do the earpiece, right?
Make sure your nose is covered, your chin is covered. Make sure you just have a tight or adequate covering.
That's correct. That's correct.
Make sure you can breathe.
Make
Thank
sure
you,
can
Gail.
breathe.
Yeah. And I guess basically once you get it on, even if I don't have one like you, one like this, just make sure, once I put it on, that it fits well.
That's right. That it fits well. That it's not baggy, because I have seen persons come in, they've worn it multiple times, so it's constantly sliding down or it's off to one side because it has lost its stability in reference to being a seal, and it's not effective anymore.
So that brings us to a great question. So how long, I mean, after you've worn your mask, I guess those types of masks in particular, should you replace them?
Right, when you lose the seal, because then
Okay.
it's defeating its purpose.
Right. Now, do you
Hmm.
recommend those type of masks, Tasha, over the cloth masks?
Not necessarily right now, because the CDC's recommendation, of course, is that we do wear masks.
Hmm.
So it's all about the protection of the respiratory area. So the surgical masks are not necessary. It's just a covering. It's a
Gotcha.
covering, but these of course are made for that proper seal that we all need to make sure that we have. So that's why these
Right.
tend to be a little bit more ideal. But some people are doing some excellent jobs. They're getting the bands
Yeah.
on the inside and things like that. So as long as you have that seal that we talked about, then you should be okay.
We're talking to Dr. Tasha Boone with the Medical Place Practice in West Columbia about masks, the proper way to wear them, when to wear them, how to wash them, and why it's important. So, Tasha, when should we? So, you said with a paper mask or the mask that you have, if your seal starts deteriorating, if it's not fitting you properly, then you should discard the
You
mask
got
and
it.
start
Yep.
wearing another mask because you're defeating the
Absolutely.
purpose,
You're defeating
basically.
their purposes. That's
Yeah.
right.
Would you say the same for a cloth mask?
Yep. It's when it loses its seal, if it doesn't have that protection covering over it, you just need to use another one. And that's why, they're leaning towards saying more of that cotton kind of material because it tends to be sturdy. Some of
Gotcha.
the other things may not be as sturdy. And so,
Hmm.
even like the t-shirt materials that tend to be really thin and may get a hole in something in them, you don't want that. You want something that has good quality but will remain its shape. That's the important thing, is to keeping the protective cover of the shape of your face.
Right.
Yeah.
So, in for plastic masks or paper masks, we throw them out. Now, what about the cloth masks? How often do we wash them, and what's the best way to do that?
I would recommend, if you soil it on the inside of if you sneeze, if you cough, if you do anything on the inside,
If you
that
get
needs to
lipstick
be,
on it.
if you get lipstick on it. I might not want to use this one again. So
Or any of your
yeah,
makeup. If you're wearing makeup and you get
yeah,
makeup on it,
right. I mean, but
it's
if it
time to
has a
wash
seal,
it.
because if you don't have access to, um, like this one, I could discard. But like like your cloth ones,
Yeah.
you just need to wash it. If it's too delicate to put in the washing machine, then hand wash it. Soap
Right.
and water, just like how we do our hands. You can use soap and water, warm water, just wash it before you put it in the dryer. Things like that. Just the basic care. I have had multiple questions about that, and I have even said, if you don't feel like it's sold and needs to be washed, then you can spray it with Lysol. Just do a
Okay.
Lysol spray when you come back in from the grocery store, and then when you do your laundry, when you normally do your laundry,
Just
throw it
throw it
in
in the
at that
wash
time.
machine. Yeah.
Mm-hmm. Mm-hmm.
I'll clean mine and I hand wash it after when I come in from the day. So I'll wear it and then the next day, that same day I'll wash it, so,
Right.
and like I said, I have three, so I'm alternating.
Mm-hmm. Yeah.
Yeah.
Right.
And I'm just washing it with hot water
That's
and, just
so.
like a hyperallergenic soap or something
Mm-hmm.
like that. And is that good?
Yeah, just soap and water. That's fine. We don't have to overthink. I don't want us to overthink and think we have to do all this extra miraculous stuff. Just like you would
Right.
wash your bandanas. We used to wear our bandanas and things like that. You would throw it in the machine. The same kind of care. I don't want people to feel like they have to do a lot of extra stuff. We just get back to the basics. And so hand washing with soap and water and letting it dry. Unfortunately, I've seen a lot of misinformation on the internet. You don't have to put it in the microwave. You
Right.
don't have to put it in boiling water. You don't have to, bleach it, things like that. You just wash it like you would wash any other cloth material piece of clothes that you have. Like I've
That's
said on my
good.
videos before, if you were not doing that before COVID-19, don't feel like you have to boil your clothes now.
Okay, that's good to know because you're right. We've heard that we need to boil our clothes, pretty much everything except for we need to just jump on in a pot
In a
ourselves.
sauna. We just need to live in a sauna.
Yeah.
We
Well,
don't
all
have
right.
to.
Chautauqua Marissa is in Charlotte. Thank you so much, beautiful, for watching. We appreciate. She said she's so appreciative for the information. Ronaldo Duggan says he puts on his mask only when he steps outside. Is that recommended? Ronaldo, thank you for your question, because that was going to be the next thing. When should we wear the mask?
Absolutely. Yeah. And so that's a good point, because you don't have to wear it all the time. So if you're out exercising by yourself and you're not going to be around anybody, you don't have to put on your mask. When you're in your car, you don't have to put on your mask. So the places that says, yes, because I know you said that earlier. And I actually saw one of my neighbors going down the street with her mask on, and I wanted to roll down the window. I was like, you don't need that on right now. But well, I was just thankful she had it.
Well, you know what? I'm going to tell you, someone told me that they put it on in their car because the exhaust, I guess the air from the outside, when it, how you put the setting on and it goes around and around. Right. Yeah. So no.
Well, we wasn't wearing it before COVID-19 when it's the same exhaust, the same car, unless you bought a new car. So like I said, I don't want people to panic and try to overthink.
Okay.
The COVID-19 virus is a respiratory transmission virus. It has to go from person to person. So it's not going to live out in the atmosphere of our air environments. We've learned, of course, how it lives on surfaces, like on the plastic and on paper and things like that. But like the outside is safe. I don't want people to feel like they can't go outside and enjoy outside. So if you having problems with your car, with the exhaust stuff, that doesn't have anything to do with COVID-19.
Right.
I don't want them to think you have to wear it in your car, just when you go around a lot of people. And so grocery stores, pharmacies, places like that.
Yeah, that's good to know, because this is what because it is airborne, I guess, because we did learn it's not only coughing and sneezing, we could be talking and then we get it. So I guess I thought, and maybe some people thought, maybe someone walked down the street 10 minutes before me and they had it. And then I walked down the street. Is it still in the air?
But
boom, boom,
But it lands somewhere. So,
yeah. So where does it land though, Tasha? I don't want it to land on me, Renato. I'm just saying. I'm just asking.
I agree.
Asking for a friend named Tre Tailor.
I don't want it to land on me either. So I understand. I do. But I understand. I do understand. Because we've had some windy days here the last couple of days.
Girl.
So I do get it. You're like, okay, if somebody sneezed and they were getting out their car, now here I am at my car. Is it on my door handle? That kind of thing. So you just have to do the best thing and just try to stay as hygienically safe as you can. Like I said, I just don't want to have people to panic. I want you to be consciously aware, but not panic, because we still got to live. We're still going to have to live outside of our homes. Eventually, we're all going to have to come outside. Right. So I don't want you to panic in reference to that. But whatever makes you comfortable. So if you feel like you are scared that the air in your car is circulating the virus, which it shouldn't have any exposure in there if you don't have it. Like if you don't have it and nobody in your family that rides in your car has been diagnosed with it, so the air in your car should be safe.
Okay.
So you shouldn't have to wear it, and it's not going to pull in anything from the atmosphere and circulate it in your car. It just...
So F. Maxine Moses says she wears hers in her car because of the pollen.
Amen. I tell a lot of my patients, and I have to agree, this mask has really helped me this season, because the pollen, the block from the pollen. So a lot of people, we talk about it all the time, the pollen on our car. We open up our car doors. Now it's on our steering wheel. Now we got our phones, so the pollen, that is a real issue, especially in the state of South Carolina.
Yeah.
But yeah.
So, okay. So let's go back to somebody sneezes and I walk by. I just want to make sure we understand. So then what? Okay, so where does it go? Does it? You said it has to go somewhere. So where is it going?
It could go. It could land. I don't want to scare you, but it could land.
Well, I just want to know what we should do. I just want to know.
I can't tell you.
Renato says exactly. I'm just trying to figure out. I mean,
hopefully you have on your mask when you're coming out to your car, because if
as soon as you get ready to come out, you need to put it on in your car so that when you hit the air,
Yeah, and I
you
guess I'm just
okay.
thinking, but I guess I'm thinking like grocery store, like crowded areas. But you're thinking like even in your outside
Yes, I'm
in
thinking
your
that
car.
because me and the kids, we walk every day around the
Right,
neighborhood.
right.
So that's what I'm wondering.
Yeah. So
And I don't wear
yeah,
my mask when I'm walking with them.
right. Most people don't because most people are not with others. They're either with their
Right.
spouse or by
Hmm.
themselves. So I do get that in the coughing and the season and things like that. So absolutely, if you feel more comfortable, especially if your car is parked in a community that has access to people walking by, I'm
Right.
not saying you don't need to put it on. Absolutely, put it on if that makes you feel
Okay.
safe. But I don't think you need to wear it, especially if it's starting to get hot and uncomfortable inside your car. But as
Gotcha.
soon as you get out, and even like at drive-throughs, we're doing a lot of pickup and curbside.
Mm-hmm.
Put it
Mm-hmm.
on before you interact with that person at the drive-through because now your window is down and you're interacting with the person who's handling whatever purchases that you're getting.
Okay. So in summary of as far as where to wear it, anytime you're in public around people.
Right.
That's what you're saying. And to
Right.
put it on as soon as you leave your car so that
Mm-hmm.
as soon as
Mm-hmm.
you're protected and someone
Right.
else is protected too.
Right. Like I put
Yeah.
mine on as soon as I put it on and then I get out my car.
Gotcha. Hmm.
Yeah.
And then when you come in the house or
When I
wherever,
come
then
in.
you take it off.
Right. Right.
Okay. All right. Terry Walker says, please say something about glove use in public.
Oh, right. Yeah, that's a good question.
Thank you, Terry.
I would say yes, but if you don't have access to gloves, don't panic either, if that makes sense. Because it is. We've learned that the virus does live on metal surfaces and cardboard and plastic. And I'm not sure if everybody has heard yet about how a lot of our big chains like Target and Walmart are not taking things back because of
Mm-hmm.
that. So you just need to make sure. That was just a tidbit that one of my patients actually told me, who's assistant manager in a Walmart, and that's because of that, because the virus is now is living, and so they didn't want to bring that back into their store.
Yeah, yeah.
So,
That's such a great point because I wondered why that was because I keep
mhm,
hearing a lot of stores are not accepting any returns. Yeah.
right, that's why.
Interesting. Interesting.
Yeah, because
Yeah. So Terry wants to know. So what do you want to know, Terry? You just want to say when should you wear the gloves? So are you saying, Tasha, should we wear the gloves just like where we wear masks as soon as we're hitting the public?
this gives an extra layer of protection for you. So I would recommend it if you have them, but do know that some stores are actually. One of my patients told me that the AAA or the liquor store said that you could not
That you
you could
couldn't
not
wear.
that you couldn't wear them because they know that the virus travels on plastic. So they were more concerned that people that had on gloves that had been to, like, I guess 10 or 15 other places before they got to them actually had the virus on their hands, so they would be spreading it on their merchandise in their store.
Yeah. And
So
yeah, and shouldn't we also be conscientious because we're being told, not to touch our face? Well, the same thing with your gloves. Your
absolutely,
gloves are exposed. The outside of your gloves are exposed. And I
that's
think
right.
people think, okay, I have my gloves on, I'm protected. But the inside of your hand is protected,
Right, and not the
not the
outside.
outside of your hand.
Right.
That's still a glove and still don't touch your face
That's
or
right.
don't touch anything.
Right. And
As
we've had to start as a policy in my office wearing gloves with every patient. But just like how I was pumping hand sanitizer before, between whenever I do, if I touch my keyboard before I touch the patient, I've got hand sanitizer, I'm washing my hands. I do the same kind of hygiene technique with the gloves and without.
right.
So I'm still using hand sanitizer on my gloves.
Okay, so
And
you're sanitizing your hand and then putting the
uh-huh.
gloves on and then
No.
sanitizing the gloves? Is
No,
that
no,
what
no,
you're
no,
saying?
no, no, no. I sanitize the gloves.
Oh, wow.
So like if
Okay.
I'm using
That's
my
good.
iPad, if I'm because I've had my computer and I'm doing my patient chart in my room, I've already touched and I'm not going to touch my patient that way. And so I'm sanitized. I sanitize my gloves and then I do whatever I need to do with my patient. And then after I touch my patient, I'm either going to take the gloves off and wash my hands and go back to my keyboard, or I'm going to I'm going to put sanitizer on my gloves because you're right, it's the outside. My
Right.
inside is fine, it's the outside. So that's something, if you think about in reference to using your gloves, it's okay to put hand sanitizer on the gloves as
Okay.
well to kind of help maybe cut down on some of the virus transmission.
So you can put hand sanitizer on your gloves. That's good.
Absolutely.
Yeah.
Yeah.
Because
Yeah.
Terry says he sees people wearing gloves in public, then keeping the same gloves on when they get into the car.
Yep.
So you're really
Mm-hmm.
taking whatever was outside in there with you.
That's right. That's right. That's exactly what you're doing.
Right. So either what?
Mm-hmm.
Either sanitize your gloves or take them
Mm-hmm.
off.
I'll take them off.
And then, of course, Maxine says, and then dispose of them properly. So tell us how to
Right.
dispose of gloves. What's the
Right.
proper
Oh,
way?
you know what? I should have bought some gloves, but you pull it from, like, you know how
Down
the
here?
band is down here. Yep. You
Mm-hmm.
pull it so that you're covering all the
The
stuff
outside. You're covering the
outside,
outside.
and then
Mm-hmm.
you turn it pretty much inside out. Is what you
Yeah.
try to do. Uh-huh.
Yeah. And then throw them in the trash because Maxine says stop dropping them in the parking lot or in shopping carts.
Amen.
Come on, people.
Yeah. Well, they probably was littering before, Maxine, so they're litterers now.
Yeah. Dispose of them safely, please, she said.
Yes.
Yeah.
Yes.
Okay.
Absolutely.
Yeah. Okay. Chautauqua says, please reiterate the the fact that people should not use cleaning solution to disinfect yourself inward, because of course we know that our president mentioned or asked yesterday during his press conference, can't people just get injected with disinfectant?
You know, I missed that press conference.
Lucky
But
you.
I've seen some
Yes.
comments about that, so I kind of figured that was something that was brought up. But yes, that's clearly dangerous. You know, any chemicals ingested inside of your body is not safe. You know, either by mouth or by needles or however. You know, like I said, I think in one of my videos, if you were not doing it before COVID-19, if we were not drinking Clorox as a liquid drink, then let's not start now because that's
Yeah.
not going to make a big difference. So definitely that is very, very hazardous to your health to even think that something as a disinfectant like Lysol or Clorox is made to be in our bodies. You know, our bodies are miraculous machines. They have a balance, a pH balance, and it's a very, very small balance. And any chemical, you know, being disinfected or anything that we ingest and put in our bodies that throws our pH off makes us sick.
Right.
So we just have to be mindful of that, and let's just think before we actually proceed to try to do something in reference to health, but logically doesn't make any sense.
Well, you know, you make that point, Tasha, and I think probably, and this goes back to something I saw that you post, not to take medical advice from someone who doesn't have a medical degree.
Pretty much, yes.
Don't take medical advice from me. I'm just telling you what Tasha told me.
And you know, and some people have good intentions, but they just don't. They're just passing on, you know, misinformation.
Yeah.
Some things they think may make sense, and so they pass it on, but it's detrimental to your health. So, you know, comments that are being made like that to them may make sense because if it kills the surface, if it kills the virus on the surface, why wouldn't it kill it inside your body? But it's going to kill a lot of other things too.
And because if you trust the source, if you trust the person and you think, even if, you know, and I think it's even if they're not a doctor, you're thinking they're around doctors and they're being consulted by doctors and they're in certain positions, we kind of give credence to what people say, even if they are not degreed. And, you know, Chautauqua says common sense isn't so common, but I think that people just think of not so much the person's pedigree, so to speak, or their education level, but their stance in life, who they are.
Right. That's right. You're right.
And who wouldn't have thought that the president knew what he was talking about? Well, me and you, but there are a lot of people who, and I'm not, you know, bashing the president. I'm just saying there are people who would trust that.
Right. Just because of who it is as a title.
Exactly.
As the title carries some weight. So
it does.
Yeah, it does.
Yeah. So Chautauqua says, thank you. Also, Chautauqua says that she agrees with that. Yeah. Thank you. Yeah. That's it. You know, Chautauqua, you just think, well, you know, people, sure. He knows what he's talking about, you know, maybe not. Maybe not. Don't ask me nothing about no medical stuff. I'm just saying, just like don't ask me how to teach a 4-year-old. I didn't know before they left school. I don't know now. I'm trying to help the brother with his ABCs, just 1, 2, 3s. But some days it's easier than other days.
Yes,
I'm not a teacher.
I remember
Because I'm not a teacher.
I'm not a teacher. I know.
And I didn't want to be one, and I'm not one, and I'm not going to be one. I'm just trying to be the best grandmother I can be right now. Tutu. The best tutu I can be. So Terry Walker says, go ahead, Tasha. What are you going to say?
I was just saying that's wonderful. That's wonderful.
Thank you.
Everybody be the best tutu and grandmom y'all possibly could be.
That's all I can be right now. Terry wants to know, what is your opinion on opening back up in the state? And do you think there'll be a second uprise of the virus if we open up too soon?
I think we kind of prematurely have opened up sooner than I would like from a health perspective.
Yeah.
Actually, this week alone, I saw more symptomatic people in my office, and I've seen the whole pandemic.
Really?
And I've actually, had a positive test that came back today for one of my patients. So it's definitely going to spread faster, I think, than it would have if we have just slowly opened back up. My concern also is that the original data, which I still agree with, said that our peak in the state of South Carolina was not going to take place till the end of April, beginning of May. So we really, in theory, have not really reached our peak in our state, which is evident by our numbers, having over 100 positive cases every day. So we have not reached our peak yet. So I do feel that we opened up a little bit more prematurely. So I understand from the perspective on the side from businesses, especially from our small business owners. I empathize with it because, I'm a business owner. So I understand that, but I do understand also the health plight too. So it was a hard decision. I know that the government officials had to make in reference to it. I'm concerned, though, that if we get out of control with the virus, they're not going to be able to shut us back down. I think once we're open, we're just open because people are not going to want to go back to kind of where we are now. So we're just going to have to be wise and smart with our decisions on where we go. Hopefully the quarantine has taught us that there are places that we just absolutely do not have to go, and we're going to be okay. And hopefully the lessons that we learn in reference to being healthy and taking care of ourselves will continue over once everything opens back up. Yeah. We definitely will have another wave in the fall. We'll get our peak. We still haven't gotten our peak. It'll die down, and then we'll have another one. We'll have another wave. I was sharing with Traven before we came live that not to scare everybody, but just to put upon you the thought process that you're going to get exposed. Everybody's going to get exposed. The infectious disease doctors talked about it in February. It's just inevitable. We're all going to get exposed to it, and nobody has an immunity towards it because it's new for us. So we're just the decade, the season. We're just the people, unfortunately, that the pandemic is happening during this. It's happened before, people made it, survived. We figured it out, and we'll be healthier down the road from what we will learn from it. But this is just the season, unfortunately, that we're living in. That our people were the ones that was chosen to go through this particular pandemic during the virus. So y'all just hold on. Be smart as you continue to, venture out a little bit more, and we'll get through it. But just know that you will be exposed, if not during this wave in the fall.
Well, Jennifer Dobby says, to your point, Tasha, that we are going to have another wave, and this is going to be, I don't know if you would call it a new normal. So Jennifer says, do you think face masks should be mandatory to wear in public places for all states for the next few months, or for
Absolutely.
How long?
Yeah, really? I do. Just as simple, I was sharing that. Actually, matter of fact, I think with my husband, I was saying as simple as we say, no shirts, no shoes, no service. Yeah. We could put that on the sign. No mask, no shirt, no shoes, no service.
No service. Wow.
I really.
And how long? For how long, Tasha?
I think data and time will tell. We could sit here and guess, August, September, that's unrealistic. That's why we really have to kind of follow the data and the trends. The trends will tell us when we think we'll be able to back off a little bit. But I would wish that they would make it mandatory for everybody to have, because now it's not really an excuse. Before, we didn't have a lot of masks because, of course, they were all tied up.
Oh
But
yeah,
now
girl.
with everybody's making them. There's videos online, with something in your home that you can use temporarily until
Yes.
maybe you can get one made. So there's not even an excuse now to say that you don't have access to a covering,
That's
because
right.
you do have access
Because you
to a
can wear a
covering.
bandana. They
You can
said,
wear a bandana,
yeah.
absolutely. Put some headbands, around it, and put your bandana on, and go on to the store. So there's no reason why nobody should be out of the house without a covering. And it's funny because now, before, we used to look at people who had a covering on, like Michael
Yes.
Jackson back in the day, like, why is he wearing that mask?
Yes.
And now you
Yes.
look at people who don't have one on, and they're the stranger. They're the oddballs now.
You're right. You're right. It's
Mm-hmm.
interesting. I posted this on my page last weekend. I was on Broad River and in Lexington. And I'm telling you, Tasha, I was out there trying to find some bleach for an elderly woman.
Oh, wow.
Couldn't find it. Couldn't find bleach or alcohol, but I digress. But I had on my mask, but there were only 20% of the people that I ran into and I went in grocery stores and Target and Family Dollar. Only 20% of the people had on masks, and the other 80% did not.
Right.
And you're right. I'm looking at them like, what is wrong with you? And they're looking at me too.
Right. Y'all looking at each other like, what's wrong with you? What's wrong with you? I know. Because now when I look at my patients that come in my office that don't have a mask on, I'm looking at them like, why are you here with a no mask on?
Right. Do you have that sign in front of you and on your door? No mask, no service.
No
mask, no service.
I might have to call the medical board to see if I can get away with that, but maybe something to consider. But we have all the CDC signs up in my office and the 6 feet rules, and we've had to cut down. You can't be a guest with the patient. Not only the patient is the one, unless it's somebody elderly that needs assistance, but no extras in the office. So we've had to do the precautionary measures even in the doctor's office in reference to that. So we'll adjust.
Dr. Tasha Boone is with us here on Coping with COVID. I'm Tre Tailor. She's with the Medical Place Practice in West Columbia, South Carolina. Darlene, Tasha says, is it good to be in a cold or hot room to kill the virus? Does it matter about temperature?
Temperature-wise in the room, it doesn't matter.
Wow.
Yeah. So you stay in the room that you're comfortable in.
And you can get it or not get it, Darlene.
That's right.
Valicia says, I'm not willing to risk losing any of my family or loved ones, period, for nothing. We know there will be a reoccurrence in the future, so why not make those adjustments to be able to live for the duration, to live this way for the duration? Yeah.
That's right. I agree. Yes. And as we travel, and as we're going to start to do more interstate traveling in the summer, people are going to be leaving our state and going to other states that have more cases. And, people are going to go, and just out of curiosity, because that's what human nature do. People are going to go to New York. People are going to go to New York to travel, and they're going to go to Las Vegas, and they're going to go to New Orleans, and they're
all the hot spots.
All the hot spots, because they're the hot spots. And so just out of curiosity, people are going to go, and people are going to want to travel on vacation there, and they're going to come back home.
Yeah.
So not only just thinking about our communities here, but, interstate wide, travel is going to take place.
Well, something I wanted to ask you about as far as, and I think Terry mentioned this, our state reopening. So our state is reopening some businesses. Georgia is just going full speed ahead. North Carolina and Chautauqua, let me know if I'm wrong, because she's in Charlotte. I don't think North Carolina has opened up anything yet. But my concern is people from other states will come to South Carolina because some of our businesses are open. South Carolinians, sure enough, are going to go over to Georgia to get their hair and nails done, because their beauty supply places, their beauticians are open and we're not. So now you're cross-contaminating from state to state. Anybody who comes in here may bring something and then go back. And then those South Carolinians that go to Georgia to get their hair, their nails done, they may, because Georgia has some higher numbers, I think, than South Carolina, may contract something and then come back into South Carolina. What are your thoughts about that?
That's exactly Dr. right. All day, you're right. That is exactly right. That's exactly what I was saying. Because now we're going to start intermingling again like we were doing before. Yes. When our coast opens back up officially, we're a tourist state. So people are going to be at Hilton Head golfing, and they're going to be in Charleston, and they're going to be, at Myrtle Beach, because that we attract that nationwide. People are going to come back, in the summertime. And so that's why we just have to use everything that we've learned during this quarantine to help protect ourselves against the virus, to continue to do that, despite what government or political recommendations are. You still have to, just use the common sense that you've learned, because they're doing it from a different perspective and a different angle. I have to say they probably do think about numbers. They have to. You perfectly think that they will have to think about the health numbers for the well-being of the state, but they have a lot of other thought processes behind why they make their decisions. So just like if they were not involved with your health before COVID-19, and you have to make those health decisions to take care of yourself with your health, then you do the same thing that you have to do to take care of your health after those decisions are made that may not have been overall for the best interest of the health, but they're just thinking about the overall health of the state.
Right.
But for you personally, just take care of you.
Right. Regardless of what the decisions that are made, make the best decision for you. Which means just because things are open, that don't mean you have to go.
Absolutely. You don't have to go to the movie theater. Netflix is, and everybody's, it's amazing.
Listen, yeah. I just read an article that Spike Lee said, no need to go to the movies. Nothing news coming out till July.
That's right.
He said the studios have shut down making movies. He says nothing coming out until July.
And a lot of big ones, my husband and I were both big James Bond fans. They're not releasing their movie until the fall.
Right.
Because they're not going to miss all that money.
Exactly.
Nothing is coming out.
So they might as well just close movie theaters back up.
That's right.
Diane Jen Cunningham, thank you, beautiful, so much for watching from North Carolina and Chautauqua. Both said that Governor Cooper has shut the state down through May 22nd. Nothing is going to open back up. And then Chautauqua said he just announced that school was going to be closed for the remainder of the school year. The same thing with us, Chautauqua in South Carolina. Right. Schools are going to be closed through the end of the school year. So at least in North Carolina, our sister state, they're not going to be open. So Chautauqua, can you please tell your people just stay on over there? Stay on over there, Charlotte. We good over here. I'd love to see you in Hez, but we're good over here. Darlene Thomas says, it's just when we go to places like the doctor office or the hospital, they keep it cold because it's known that cold keeps the viruses down. That's what they tell us. So they need to stop freezing us if that's not true. Why do they say that?
It does have some validity. It does, that part. But I thought you meant in reference to your home.
That's what she meant.
Yeah, so in the home,
so that's what she wants to know. Does she need to keep it cold like the doctor's?
We do have it a little bit chillier because we do know that it does not manifest, as much of the bacterial spread. So we do keep it on the colder side for that purpose. But I don't want you to feel like you have to live like you at the doctor's office. You just keep it comfortable in your home. But we do keep it a little bit chilly for that.
Okay. Kevin Fortune wants to know that initially it was said that the N95 masks offered the greatest protection. Has that changed, and will a regular surgical mask work? You answered that earlier. You can answer it again, Tasha.
Yeah, the protection that you have to cover is just all about the covering. Of course, the N95s are the top of the line. I would recommend that don't stress out if you can't find any. We do need to kind of keep those preserved for our medical workers, that are on the front line in the ERs and things like that for now. But if you have access to one, absolutely wear it. But, even in my office, I just wear my surgical mask unless there is somebody who's clearly symptomatic. Then I do put in my N95 because it adds that extra protection. But, for you just going in and out of the grocery store quickly and things like that, just have something over your mouth and nose. Yeah.
Hey, thank you, Kevin. When you get a chance, watch the show again, because that's what she talked about. She said the cloth masks are good and the bandanas are good. The biggest thing is what you said, Tasha, was just as long as it adequately covers your face, Kevin, and you've got a good tight seal.
And we didn't talk about this on this part of it, but wearing it down here,
right,
it's not a good thing, Up here, I've had patients come in and I was like, how do you even see me? It's up here.
Yeah.
down here, lifting it up to eat and just keeping it up here the whole time. So just as long as it's covering what's supposed to be covering.
Yeah. So let's talk about that. So, and because you made a good point, because I do see people, push it down or push it up to eat and then put it back on. Tell us the proper way to wear it.
Right. You just have to make sure that you have that covering. It just has to be the covering all the way. If you're going to eat and drink, just take it off.
Take it
because
off.
you're gonna get all those particles and the liquid and everything on the inside of your mask. Anyway, so just take it off if you're going to
Take it
eat.
off. Right.
I think some people kind of adjusted. I think some, now that I'm seeing more people wear it, I think they're just lost their seal. So it's dropping down. Some people do get uncomfortable with it. It gets warm. You're just not used to it, and I empathize with everybody who's not in medicine to have to learn how to wear a mask. That's not an easy transition. Everybody's been thrown into this medicine world. So it does take some adjustments to getting used to kind of wearing it. People have glasses and they're getting fogged up.
Oh,
with
girl.
Their glasses.
Yes. Do you have a remedy for that? Because you're a glasses wearer and I am too. I did read something. I got to figure that out.
You just got to make sure
because you get that little fog and you can't see. It's a mess. A mess. So what do you do? What do you do, Tasha?
You just readjust it. You just have to readjust it and seal it off.
Yeah. All right. Kevin Portis says, thanks. Hey, John Lakin is watching. Thank you so much for the hearts. Jennifer Giabe says, what do you think, Tasha, of the people who say their freedom is being taken away from them because in certain states it's made mandatory to wear face masks and also keeping the stay-at-home order in place until June? What are your thoughts about that?
You mean in reference to somebody saying their freedom to, being mandated?
Yeah.
And stay home? Like what I think, do I think that their freedom is being taken away? Is that what?
Yeah, is that what you're asking? She says, what do you think? She says, what do you think of the people who say their freedom is being taken away because in certain states it's been made mandatory to wear face masks and also keeping stay-at-home order in place until June? I guess that's two different questions.
Yeah.
What do you think?
I think the lawmakers are going to have to come up with something for the overall health of people. Period. So I think it's going to have to come from the political standpoint, because from the health doctor's perspective, we were saying all day you need to wear a covering, but I don't think we have enough authority just as a body of medical doctors to be able to make that mandatory. So that's going to have to be something I think we all need to kind of take up with our local political officials and our government officials, and hopefully it will go national, because something is going to have to adjust and change in reference to that. I'm not quite sure if it's legal for them to do anything for somebody who does not wear a mask. Like I said, I think it's going to have to go also from the business perspective, like we said before, because they have the signs up: no shirt, no shoes, no service.
Yeah.
So maybe just starting with that simplicity of it. National chains like Walmart starting it and Target starting it, and a mom and pop stores, small business owners being able to start it. That probably be the quickest way that I see that maybe that will start the trend of people realizing, okay, I'm making a decision not to wear a mask, but now I can't go into Walmart. So it's almost like backdooring in, forcing people to kind of do that until we are better off where we won't have to have it. But we're going to have to wear them for a while.
Right. A while. What does that look like to you, Tasha? What does a while mean? Because you and the experts, even DHEC says that we are going to get another wave of it. So, and then I heard you say earlier that you still think we've got a peak going, but then DHEC said, Dr. Linda Bell said a couple of days ago that she thought maybe we had seen our peak.
I think numbers were going to tell us. Like I said, it's just time, because now what has happened is that we're a little bit more lax with our stay-at-home order. So now we've got more exposures. The data still has not caught up with how many testing we have in our community. We do not have enough tests in our community. That's the bottom line. As a physician, I still don't have tests in my office. The only testing that can be done in Columbia right now is at Prisma Health. You can get a schedule. If you come through your doctor's office, we can kind of help get stuff scheduled, but it's still only if you're symptomatic. So I don't have access to be able to test somebody who I feel like maybe who's been exposed, but don't have the symptoms and could be a carrier. You can go, of course, to Lexington Hospital through the ER, but that's only if they decide that you're deemed testing. So there's no way in the world that the data that we're seeing from DHEC is accurate. It's not, because we just don't have the testing in our community because the government pretty much has locked up all our testing. So that is what is going to delay us really knowing our numbers. And most likely, it will be mid May before some of us, even in community, will be able to have testing even in the community to be able to start the testing. So when that starts, those numbers are going to skyrocket all over again. It's just they're going to go up because we're going to be able to have a better idea of really what we're having in the community. So
this is something.
It's months. It's months. It's going to take us months to get a handle of it. I don't foresee us before July, to be honest, to be able to say, okay, maybe we could take a little bit of a breather. Maybe we can start opening up some bigger things. And by the time that starts, and we've got to think about school, it's going to be starting back hopefully in August, may or may not, depends on what the numbers show. And then we're flipping right back around in September and October for flu season.
And then that's flu season on top of COVID.
It's flu season on top of COVID. But we don't know. We haven't had enough knowledge and understanding of COVID to understand if it really is seasonal. Our deduction is because that's when it kind of peaked overseas, was in the fall and the winter. But there's no telling just because it's warm that is actually going to go away. Because we're still pretty much, sharing the virus in the community right now. So there's no telling it. Unfortunately, it's going to take a season or two for us to really understand it. We don't have enough knowledge of it yet. And we don't know either also if you've been exposed and you make an antibody to it. If you get re-exposed, is that antibody truly for what it is? Because like we know about the flu vaccine, everybody keeps comparing the coronavirus with the flu vaccine. Well, the flu changes every season. That's why you have to get a flu vaccine every season. So we haven't had another season of the coronavirus to even understand if it's going to change or if it is what it is. So it's going to take time for the medical world to kind of get caught up with it, and I just want everybody to be patient. I know it's warm and we're excited and we're ready to have a breather, but you're just gonna have to practice a little bit of patience like Job did till we can kind of figure it out. And just keep in mind is to keep yourself healthy the best that you can under the circumstances that's going on right now.
Well, you made such a great point, Tasha, because that's something else that I saw you post on your page, was that you've got to keep yourself healthy, particularly because of this now, because this is not the time you want to be sick with anything. Yeah, you don't want to be sick right now.
You just don't want to be sick. Try not to be sick.
Yeah, keep yourself, take your pressure medicine, make sure your sugar is okay.
That's right, absolutely.
Don't ride a bike without your helmet on. That's right. You know what I mean? Just make sure you don't, because this is not the time you want to get sick. Because why? The medical profession is the
system right now is strained. It was strained before, and it's super strained now. Also, I do want to emphasize that you talked about health. Also, to keep in mind that I don't want you to be afraid to go to the hospital if you need medical care, because that's been a concern. Believe it or not, we've gotten several messages and emails from the American Academy of Family Physicians, and a lot of articles were saying that the doctors are actually concerned because the admissions for strokes and heart attacks have decreased. So people are still having strokes and heart attacks.
Wow, staying at the house.
But they're not coming to the ER. So they've already seen the data. The number of 911 calls have gone down. The ambulance is not rolling as much as it used to. So I do want to kind of put that out to everybody to let you know that you can still come to the hospital
if you really need it.
If you need it. Don't feel like you can't even go if you need it, because that is concerning that we're not seeing heart attacks and strokes. Those just not stop because of COVID's here. They're still going on.
Right. That's such a great point, Tasha, that you said. If you need it, please go to the hospital.
Please go.
But if you can make a choice, just be extra careful to make sure that you don't get sick. Just do those extra steps that you have to do.
Absolutely. That's
Eric Curry
correct.
says, this is great information. Diane Jen
Oh,
Cunningham
good.
says, thank you so much for sharing. I only pray that people will listen and put this into action. Nicolette Robinson says, Dr. Boone is the absolute best. Thank you for keeping us safe and demanding safety. This is Dr. Tasha Boone in Columbia, South Carolina, West Columbia, South Carolina, with the Medical Place Practice. Tasha, I want to ask just a couple of more things. Nicolette did say Facebook has canceled all of their major conferences for the rest of this year and part of 2021. So they are being
Wow.
proactive in making sure
Mm-hmm.
things are shut down. Maxine says, if you wear glasses and they're fogging up, to use shaving cream to wash the glasses, and that stops the fogging.
I have
Good,
to
good
try
tip.
that.
Yeah, me
Yeah.
too. I've got to try that. So, Tasha, I wanted to know, what about kids? Should kids wear masks too?
The CDC recommends under the age of 2, they do not need it. I think it's
Okay.
for multiple reasons. They're not going to wear them anyway. They're going to be aggravated. Parents are going to be stressed out trying to keep it on them. So they're saying under 2, no. So anybody over 2, they are recommending it. So far, thankfully, we have not seen as many deaths with our younger children, which has been a good thing so far. So, in reference to the children, if they will keep them on, that would be great. School age children, they should be able to wear it. Hopefully, they're not going too many places anyway.
Right,
But if you
right.
have to run out,
But if
if
you've
you don't have
got
a
them with
babysitter, if
you,
you got it with you, yeah.
okay.
So,
So, and no one under 2, but
right, 2
any
and under,
children
yeah,
over 2 would be
yeah,
good. All right.
yeah.
Jennifer Dalby says, great information. Thanks for sharing. Valicia says, I'm guilty. The nurse told me to go to the ER last month, but I was afraid to get COVID, so I didn't go.
Whew.
She says she toughed it
Yeah.
out.
You gotta go. It's still, it's clean as it was prior to you even we having the COVID exposure. I want to let everybody know that all the hospital systems that I know of have a great triage system set up. You're not even going to go in the area with anybody that has the COVID-19 symptoms because they got a fabulous triage. You outside, literally they have tents and everything set up. So you come there and you say, okay, I'm having chest pain. They're immediately going to send you to the chest pain area. You're
Mm-hmm.
not even going to go to the area of somebody who may be coming in with a cough or a fever.
Okay.
So, mm-hmm.
Yeah. All right. Thank you guys so much for joining us. This is Dr. Tasha Boone with the Medical Place Practice in West Columbia, South Carolina. Tasha, any closing information that you can give us?
Just, take care of yourself. Use common sense. Know that your doctors are available. The ER is still available for other things outside of COVID-19. I think that's an important thing. Protect yourself. Wear the coverings that we talked about, the hand washing, the things that you know that you need to do to help take care of yourself. Be mindful. Everybody is not going to follow the rules or the recommendations from healthcare perspectives, but that's just being people. People don't
Right.
follow recommendations that we've been given for 100 years for certain things. So try not to stress out when you see other people not doing what they're supposed to, and you just do the right thing and take care of you, and we're going to be fine. We'll get through this season. We'll understand it. We'll be able to live to tell the stories to our grandchildren and our great grandchildren, and they'll come up with the vaccine, just like now we have the chickenpox vaccine. I don't know if y'all remember, but before, everybody used to get the chickenpox. Now,
Mm-hmm.
my children don't know anything about that because they got the vaccine. So we will see the positive part of it for us going through this journey now. So we're the strong ones. We're going to survive. We're going to be okay. But y'all just take care of each other and take care of yourself. And we're here to help however we can as we all journey through this COVID-19, which will
Yeah.
soon be COVID 2020.
Wow. Yeah. Yeah. Tasha, we do have one more question. Chautauqua wants to know concerning COVID-19, is a dry cough worse than a wet cough?
No, a cough is a cough. So if you're having a fever, over 99.5 is what we're concerned about. A cough of any sort, there is no difference with a dry versus a wet cough. Shortness of breath, any of those things, any of those 3 things, exposures to anybody, you start to develop a cough. Also, we've learned about the GI components of it. The taste buds, that's been real. The data, we've had some veterans in a VA hospital here. I've been able to talk to some caregivers, and the taste buds, losing the taste buds and the taste, that's real. So people are having those symptoms and having the COVID-19 secondary to that. So like I said, we're learning, but there's no difference really with the cough.
Okay.
Worse than another. Yeah.
Right. And of course, there are some people they don't get symptoms at all.
They don't get symptoms at all. Yeah, they're the carriers. They are the carriers. But we're getting the tests are slowly coming out that we'll be able to test the antibodies, because once your body's been exposed to a virus, it makes the antibodies. It's very smart, so it doesn't forget its exposure. So we'll be able to have those testing, but it's going to take a little bit of time before it comes to the market where I would say the general population of people will be able to get it. But that will come, and then we'll be able to know if they're carriers or not.
One more question. If you got it before, can you get it again? Can you be reinfected?
I think that's what time is going to tell, because we don't quite know if
you
it's
don't
going
know.
to tweak. Yeah, if the virus is going to tweak itself or not.
Yeah.
Yeah.
Gail Smith says, thanks for the great information. She's watching from Mississippi. Thank you so much, Gail. And also Gerald Salmon says, praying for you, Dr. Tasha. Thanks for operating in your gift. So thank you, Gerald, so much for watching and for everyone's comment. So Tasha, I leave every Coping with COVID with a Jesus Calling, with the Jesus Calling for today. And I'm not sure if you are familiar with Jesus Calling, but no matter when you read it, I think, did you get one last year? For Women's Day? Yes. So here is it for today. It's always so timely. It says, rest in the stillness of my presence while I prepare you for life. Let the radiance of my glory shine upon you as you wait on me in confident trust. Be still and know that I am God. There's both a passive and an active side to trusting me. When you rest in my presence, focusing on me, I quietly build bonds of trust between us. When you respond to the circumstances of your life with affirmation of trust, you actively participate in this process. I am always with you. You have no reason to be afraid. That's Jesus talking. That's Jesus calling for today. And as always, it's so timely for what we're going through. Thank you again so much for watching Coping with COVID. Dr. Tasha Boone, thank you again so much. Please continue to like and share this post so that more people can get the information. And please check out Tasha's page, because she gives such great information daily. And I'm going to be posting and pushing out her stuff also. Tomorrow on Coping with COVID, we're going to answer more of your medical questions with Dr. Nicole Edwards. Next week on Tuesday, we're going to talk to Shakise Newton. She's the Richland County Councilwoman. They've got some funding available for small and minority businesses, so please check out that. And then on Wednesday, we'll talk to national best-selling author and thought leader, Marianne Williamson. All of that and more coming up on Coping with COVID. I'm Tre Tailor. Thank you again so much for joining us. Stay safe, be careful, and be blessed.